The majority of people want to improve their health. They rarely consider protecting and maintaining the health of their lungs. It's time to make a change. Chronic lower respiratory diseases, including chronic obstructive pulmonary disease and emphysema, are the sixth leading cause of death in the United States, according to the Centers for Disease Control and Prevention. These conditions, excluding lung cancer, were responsible for 142,342 deaths in 2021. Meanwhile, lung cancer is the leading cause of cancer death in the United States, accounting for 139,601 deaths in 2019. Your lungs, like your heart, joints, and other body parts, age over time. They may become less flexible and lose strength, making breathing more difficult. However, by adopting certain healthy habits, you can improve the health of your lungs and keep them working optimally even as you get older. 1. Exercise to breathe harder. Aside from not smoking, getting regular exercise is probably the most important thing you can do for your lungs' health. Exercise not only keeps your body in shape, but it also keeps your lungs in shape. Exercise causes your heart to beat faster and your lungs to work harder. Your body needs more oxygen to fuel your muscles. Your lungs work harder to deliver that oxygen while expending more carbon dioxide. According to a 2016 article, during exercise, your breathing rate increases from 15 to 40 to 60 times per minute. That is why it is critical to engage in aerobic exercise on a regular basis. This type of exercise is the most beneficial to your lungs. The muscles between your ribs contract and expand, and the air sacs inside your lungs exchange oxygen for carbon dioxide quickly. Your lungs become more efficient as you exercise. Exercising to build strong, healthy lungs helps you resist aging and disease. Even if you do develop lung disease later in life, exercise can help to slow its progression and keep you active for longer. 2. Prevent infections. Infections are especially dangerous to your lungs as you get older. Those suffering from lung diseases such as COPD are especially vulnerable to infection, also known as pneumonia. If seniors are not careful, even healthy seniors can develop pneumonia. Keeping your hands clean is the best way to avoid lung infections. Wash your face with warm water and soap on a regular basis and avoid touching your face as much as possible. Drink plenty of water and eat plenty of fruits and vegetables, which are high in nutrients that help your immune system. Maintain your immunization records. Get a flu shot every year and a pneumonia vaccination if you're 65 or older. Additionally, keep up with the required booster shots for COVID-19. 3. Don't smoke or stop smoking. You are probably aware that smoking increases your risk of developing lung cancer. However, it is not the only disease it can cause. Most lung diseases, including COPD, idiopathic pulmonary fibrosis, and asthma, are linked to smoking. It also worsens the severity of those diseases. Smokers, for example, are 12 to 13 times more likely than non-smokers to die from COPD. Furthermore, smoking is responsible for approximately 90% of all lung cancer deaths in both men and women. Every year, lung cancer kills more women than breast cancer. How does smoking damage the lungs? When you smoke a cigarette, you breathe in thousands of chemicals, including nicotine, carbon monoxide, and tar. Toxins harm your lungs by causing mucus buildup, making it difficult for them to clean themselves, and irritating and inflaming tissues. Your airways gradually narrow, making breathing more difficult. Smoking also accelerates the aging of the lungs. The chemicals can eventually transform benign lung cells into cancerous ones. What are the benefits of quitting smoking? Regardless of your age or length of smoking, quitting can help. According to the American Lung Association, the carbon monoxide level in your blood returns to normal within 12 hours of quitting. Your lung function will begin to improve within a few months. Within a year, your risk of coronary heart disease is cut in half. And it only gets better the longer you go without smoking. It usually takes several attempts to quit. It is not easy, but it is worthwhile. Combining counseling and medication may be the best way to succeed, according to a report by the United States Preventive Services Task Force. 4. Avoid exposure to pollutants. Pollutants in the air can harm your lungs and hasten your aging. Your lungs can easily resist these toxins when they are young and strong. However, as you age, you lose some of that resistance and become more susceptible to infections and disease. Give your lungs a break. Reduce your exposure to the greatest extent possible by avoiding secondhand smoke and trying not to go outside during peak air pollution times. Avoiding exercise near heavy traffic, as you can inhale the exhaust. Minimize exposure to airborne pollutants at work, such as in construction, mining, and waste management, by taking all possible safety precautions. According to the U.S. Consumer Product Safety Commission, indoor pollution is typically worse than outdoor pollution. This, combined with the fact that many people now spend the majority of their time indoors, increases exposure to indoor pollutants. Here are some suggestions for reducing indoor pollutants. Make your home a smoke-free zone. Dust the furniture and vacuum it at least once a week. Open a window frequently to increase indoor air ventilation. Avoid synthetic air fresheners and candles that can expose you to additional chemicals like formaldehyde and benzene. Instead, use an aromatherapy diffuser and essential oils to scent the air. Keep your home as clean as you can. Mold, dust, and pet dander can all irritate your lungs. Use natural cleaning products when possible and open a window when using products that create fumes. Make sure you have adequate fans, exhaust hoods, and other ventilation methods throughout your home. 5. Breathe deeply. Many people take shallow breaths from their chest area using only a small portion of their lungs. Deep breathing clears the lungs and allows for complete oxygen exchange. Participants in a 2016 South Korean study of 30 smokers over the age of 65 were divided into 4 groups. For 6 weeks, 3 groups did different breathing exercises 3 times per week, while the control group did not. For the past 2 weeks, none of the groups did any breathing exercises. Measurements 4 weeks after the study's start revealed improved lung function, which declined significantly in the final 2 weeks. The American Lung Association agrees with these findings. Breathing exercises can improve lung efficiency. Sit quietly somewhere quiet and slowly breathe through your nose alone. Then, exhale through your mouth for at least twice as long. Counting your breaths may help. Count 1, 2, 3, 4 as you inhale, for example. Count 1, 2, 3, 4, 5, 6, 7, 8 as you exhale. Shallow breaths are taken from the chest, and deeper breaths are taken from the belly, where your diaphragm is located. As you practice, pay attention to how your belly rises and falls. These exercises help you to feel less stressed and more relaxed. Try to incorporate the following 5 habits into your daily routine. Quit smoking, exercise regularly, limit your exposure to pollutants, avoid infections, and breathe deeply. By devoting some of your energy to these tasks, you can help keep your lungs in peak condition for the rest of your life. Thank you for watching. As you've learned, there are many healthy habits you can adopt to keep your lungs working optimally even as you age. But don't stop here. Click the next video to discover the top 10 lung health foods. By watching that video, you'll learn how to support your lung health with delicious and nutritious foods. So hit the like button and subscribe to our channel for more valuable health tips. Thanks again for watching, and we'll see you in the next video.